In this presentation, I'm going to talk about rotator cuff muscles. Rotator cuff muscles included supraspinatus, infraspinatus, tres minor, subscapularis. Altogether, they assist in stabilizing the shoulder joint as well as in performing various arm movements. Four muscles and their attached tendons make up the rotator cuff. Altogether, they help hold the upper arm in place in the shoulder socket. First, supraspinatus muscle. Supraspinatus muscle innervated by a suprascapular nerve. Abducts arm initially, the first 15 degrees of motion, before the action of deltoid muscle. After that, deltoid and trapezius muscles take over the action. Supraspinatus is the most common rotator cuff injury caused by trauma or degeneration and impingement result in tendinopathy or tear. Assessed by MT Fulcan test. The second muscle is infraspinatus muscle. Infraspinatus muscle innervated by suprascapular nerve. It is the main muscle responsible for lateral rotation of the arm away from the center line of the body. It means externally rotates arm. It covers the back of shoulder blade deep below the skin and close to the bone. Pinching injury is the injury of infraspinatus muscle. Teres minor muscle is the third muscle that innervated by axillary nerve. Tres minor is a small, narrow muscle on the back of the shoulder blade just below the infraspinatus muscle. Abducts and sternally rotates arm. The last one is subscapularis muscle, the fourth one, innervated by upper and lower subscapular nerves, innervated primarily by C5 and C6 of spinal nerve roots. Subscapularis is a large triangular shaped muscle that lies below the other three muscles. It is the strongest, largest, and most used of the four rotator cuff muscles. It participates in the most shoulder motions but is especially important for rotation of the arm toward the midline of the body. It means medial rotation. Unlike the other three muscles, the subscapularis muscle attaches to the front, not the back of the upper arm. This is subscapularis muscle. A rotator cuff injury can happen suddenly, such as falling on outstretched arm, or it can develop slowly, resulting from repetitive motions or age-related degeneration. Common injuries of rotator cuff. 1. Tendinopathy. This is pain in and around the tendons. It means tendinitis. Rotator cuff tendinitis is considered the mildest form of rotator cuff injury. It can develop from age-related degeneration, overuse, repetitive motion, trauma. The second injury is impingement. This occurs when the top of the shoulder, it means the acromion, rubs against the tendon and the bursa and irritates the rotator cuff. Third injury is bursitis. The bursitis around the rotator cuff can fill with fluid and swell. The fourth one is partial tears of the rotator cuff tendons. Fifth, full thickness tears. The tendon is completely torn from the bone. Chronic degeneration is usually the reason. The sixth, bone spurs. These can form when rotator cuff tendons rub on the shoulder bones.